This is WFYI News Now. It's December 6th, and I'm Abriana Herron. On today's show, an update on ridership in the Pacers Bikeshare program since Indy Rides Free initiative kicked off. Governor-elect Mike Braun doubles down on his outlook for the future of Indiana's schools and students. And heated testimony on the fourth day of the criminal trial for IMPD officers charged in the death of Herman Whitfield III.
Officer Ahmad said he did not observe any signs that Whitfield was in medical distress, even when he was silent, and that he acted in accordance with his training.
Those stories are coming up, but first, the next installment of our regular segment called The Checkup from Side Effects Public Media, where the health reporting team explores a single question sparked by a recent news story or maybe by one of our listeners.
It can feel like more than ever before, people are questioning long-held scientific findings, from the safety of fluoride in water, the efficacy of vaccines, or even the importance of pasteurizing raw milk. Trust in science has fallen since before the pandemic. So let's get back to the basics and ask, what is science, and how can public health experts better explain the processes that lead to these health recommendations? That's the Checkup's question for today. I'm Lizzie McGreevy, Side Effects Public Media's Community Engagement Specialist, and I'm joined today by health reporter Ben Thorpe.
Hi, Lizzie.
Hi, Ben. So maybe a good way to kick this off is by talking about the shift healthcare professionals, doctors, and so on are seeing as people are coming in for those office visits.
Yeah, so several of the researchers I spoke to say there's been a rise that kind of even predates the pandemic of people doing their own research, so to speak, coming into a doctor's office or a dentist's office and saying, hey, I read this study or I saw these news clips. I have questions or concerns about a procedure or a particular medical practice. And I think on some level, they say that kind of engagement is obviously good. People want to make informed decisions about their health and are taking steps to be proactive about informing themselves. I spoke with Jennifer Reich. She's a sociologist at the University of Colorado and the author of Calling the Shots: Why Parents Reject Vaccines. She says the problem is that how you or I do research for, say, what's the best laptop to buy doesn't line up with how scientific research works around something like, say, vaccines.
We gather information, we read online reviews, we talk to people we trust, and we make what feels like an informed decision, which is really not the same as how researchers think of research, right? Research is a long process of meticulous procedures that can be replicated and accounted for that are not aimed at a particular outcome.
Right. So you can just call me out and say this is an intervention, because I definitely show my doctor TikToks proving to her that I have ADHD. But if I want to inform myself, what am I supposed to do and where should I be looking for this information?
Yeah, I think that's kind of the million-dollar question right now. In many cases, the kinds of research studies you or I might be able to pull up right now online might be of lower quality. Accessing studies from the most reputable medical journals can cost a lot of money, with some of the highest caliber stuff stuck behind paywalls. There are signs that this might be changing, but that's kind of problem number one. Problem number two is that fewer people have the relationship with their primary care doctors that they might have had, say, 20, 30 years ago. So there aren't always the avenues to have these larger conversations about research and health concerns, or even TikToks, that you might want to be able to have with a trusted professional. Here's Reich again.
All questioning is not bad, but there has to be an opportunity to have it be productive and generative and not just a veto.
You talked a little bit about paywalls and this information being difficult to find. What does this all mean for communicating public health to the actual public?
Yeah, so the experts I spoke with say research is full of disagreements between experts and have to be ironed out over the course of many studies, over the course of years, and sometimes even decades. But the public may not always understand that. I spoke with Dominique Bossard. She's the chair of the Life Sciences and Communications Department at the University of Wisconsin-Madison. She says she actually really dislikes the phrase, follow the science.
It is ridiculous. We follow the science where? Doing what? I don't want to follow the science. I want science to be part of the discourse and bring data to make the best policy decision to fit the public good.
Bossard also says that there's a question about who people trust to give them accurate information. Trust in science overall has fallen since the pandemic, but it's still relatively high at more than 75% compared to, say, trust in government institutions. That means that those nuanced conversations with a local doctor are almost more important to the average person than, say, the advice that comes from the Centers for Disease Control and Prevention.
Ben, thank you for this great information. I'm going to start writing my list of questions for my doctors immediately after this. And thanks for taking time to talk to us today.
Lizzie, it is always a pleasure.
It's been fine. If you, dear listeners, have questions that you're too shy to ask your doctor, things that you think the public should know, or you have questions about these viral TikTok videos you're seeing, or wild claims on Reddit, please let us know. And in the meantime, stay safe.
That was The Checkup by SideFX Public Media. SideFX is a regional health reporting collaboration of NPR member stations across the Midwest, based here at WFYI. More Marion County residents are riding Pacers Bikeshare bikes than ever before. The Indianapolis Cultural Trail runs the Bikeshare program and says there's been a 51% increase in ridership from a previous high. That's due in large part to the Indy Rides Free program that launched in May. The free program allows Marion County residents to ride any Pacers Bikeshare bike or e-bike for up to 30 minutes. Alex Kuhn has been a regular user of Indy Rides Free since its launch.
The amount of stations downtown makes it really convenient to get anywhere I need. You know, there's a lot of stations near sort of the regular places that I'd like to go.
He says he appreciates that the program adds another transit option for Marion County residents.
This adds a fourth dimension of travel that has really added a lot of flexibility for me as someone who lives and works downtown.
The Pacers Bikeshare currently has 51 docking stations around the city. 2 more stations will open later this month in the Elevator Hill neighborhood. Governor-elect Mike Braun doubled down on his outlook for the future of Indiana's schools and students. WFYI's Rachel Fredette reports that Braun holds strong to his campaign pitches in his first-term agenda.
Braun wants to address the teacher shortage by increasing base salaries for educators and encouraging students to consider their career through apprenticeship programs. In a more controversial policy, Braun's agenda seeks to limit gender identity conversations in schools and ensure that transgender girls are not allowed to play in girls' sports. That's already established in state law. Braun will direct the state's Department of Education to study the effects of the COVID-19 pandemic and subsequent mask mandates on school children. Any new policies from Braun would require legislative input and likely laws to be passed. Senate and House leaders have already hinted that some of Braun's wishes, like school choice expansion, could come up during session. They plan to unveil their priorities for session in early January. I'm Rachel Fredette.
The legislature convenes in January. And for our final story today. Defense for Indianapolis police argued that THC, the chemical that causes the high of marijuana, contributed to the in-custody death of Indianapolis resident Herman Whitfield III, not police actions. That was during heated testimony on the 4th day of the trial of 2 IMPD officers. WFYI's Ben Thorpe reports.
Thursday, the jury heard from Officer Adam Ahmad, one of the 2 police officers charged in the death of Herman Whitfield III. Officer Ahmad said he did not observe any signs that Whitfield was in medical distress, even when he was silent, and that he acted in accordance with his training. The jury also heard from 2 expert witnesses. The first was Dr. Bill Smock, an emergency medicine forensic physician. Smock told the jury that THC combined with evidence of cardiac disease and Whitfield's obesity was a time bomb that would have gone off regardless of the police's response. That argument was contested by the prosecution's witness, cardiologist Dr. Alon Steinberg. Steinberg told the court that THC causing someone's death is extremely rare. He said Whitfield died due to being restrained in a prone position by police. I'm Ben Thorpe.
Closing arguments in the case are planned for Friday. That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back on Monday.